Hi, this video is about releasing tightness in the shoulders and upper back and neck. A common experience for a lot of us these days with spending so much time at computers. If you look in the mirror and look at your collarbones, and they look slightly like this, like the collarbones are kind of lifted up, there's a good chance that you're someone who experiences a lot of pain in your shoulders, up into the neck, into the chest. This can be a result of what's called first rib syndrome or thoracic outlet syndrome, or simply just stiffness in your shoulder. So the exercises I'm going to show on this video are to release tightness in all of these areas: shoulders, rib, upper back. So let's start with the first one, which is you'll need a couple of balls. Tennis balls can work, but sometimes they split. These are little massage balls which have a little bit of give to them, which work really well. Otherwise, you can just use a kind of rubber bouncy ball like this. And what you're going to do with this exercise is you're going to place the balls on either side of the spine and then hold the hands behind the head. Slightly lift the tailbone, lift the hips so that all of your weight is onto the balls, and then slowly roll the balls down the back by moving the whole trunk backwards toward the head. You might get about halfway down the spine before you need to bring the feet a bit closer to the hips again, and then carry on down to just above the lower back region. And then maybe do that one more time. So balls on either side of the spine, so just at the very top where the trapezius is, hands behind the head. Make sure you lift your head slightly, lift up the hips. You'll need to do this without a shirt on, otherwise the shirt gets scrunched up into your neck. And keep rolling down, so the balls roll down on either side of the spine. Can be quite intense the first time. It's a kind of way of releasing the fascia on either side of the spine. So that's one option. If you have one shoulder which is tight and not the other, then what I would recommend is take the ball just to on one side of the shoulder. So let's say it's the right shoulder, and you're going to place the ball right at the top of the trapezius like this, and then lift up your hips. So we'll start with the arms down so that you've got the ball right into the space on the inside of the shoulder blade at the top of the shoulder. Get some pressure into that area, and then slowly lift the arm and try to take the arm back, which again can be quite intense the first time. This really helps to push that first rib back into position. So do that a couple of times. And then you could move the ball a little bit further down now. So a little bit down toward the lower back. Same thing, lift up your hips. So you've got the ball between your spine and the shoulder blade. And lift up the hips, slowly take the arm back. And as you take the arm back, you'll see how the ball presses up into that area between the spine and the shoulder blade. So you could just pause the video at this point and repeat that same exercise on the other side. Then we'll do another one for releasing the first rib, which is sitting on a bench, and with this one you can sit on a chair or a bench. Have it so that your hips are slightly higher than your knees, and let's say we're releasing the left shoulder in this case. So you're going to hold the bench, the seat of the bench, with your left hand and pull down with your left hand, so the shoulder is being pulled down like this. Turn your chin slightly to the left and bring the chin down. And then to do a kind of contract release, we're going to try to lift the left shoulder up toward the ear to create some activation in that muscle. Then release that pulling and turn the chin a little more, bring the chin down. And again, try to shrug the shoulder up against the resistance of holding the bench, the chair. Release the pulling, turn the chin, bring the chin down. So you're going to feel that into the scalene muscles in the side of the neck. And release. And let's try that on the other side. So holding the bench with the right hand, drop the head toward the left. Turn the chin slightly to the right and bring the chin in. While holding the chair with your right hand, try to shrug the right shoulder up. Then release that. Bring the chin in a little more, turn the head. Again, try to shrug the shoulder up away from the chair. Release, turn the chin, bring the chin down. One more time. Try to shrug the shoulder up. Release, turn the chin, bring the chin in. Excellent. If your pain is on one side and not on the other, you could use a belt. And let's say that your pain is more on your left side and your left shoulder, and you suspect it's coming from an elevated first rib or being pinched. You can take the belt like this, so one hand goes behind you, so in this case the right hand behind, and the left hand in front like this, so pain is in the left shoulder. And we're going to pull down with both hands, slightly more with the back hand, because you want the sense of the shoulder girdle going back a little. And while you're doing that, turn your chin to the left, bring the chin in. Release, keep the head where it is. One more time, press down with the left hand and a little more with the right. Turn the chin, bring the chin in. Release, keep the head turned, keep the chin in. And release. Then a couple of others for releasing the shoulders. You can just use a normal chair for this one, and take your chair, spread your hands out on the chair, and bend your elbows slightly to gather the elbows, crease of the elbows facing each other, and then as you inhale, slightly lift the ribs. As you exhale, slightly take the navel forward. So you don't want your back collapsing like this, and equally you don't want to be up like this, somewhere in between. So as you inhale, slightly lift the ribs. As you exhale, navel forward. One more time. As you inhale, lift the ribs. As you exhale, navel forward. If that hurts your shoulder, don't do that one, because that can be quite intense on the shoulders. Then for the next one, we're going to use a pole. You can use a kitchen rolling pin, but something like this, and this Pole is approximately 40 centimeters in length, and you're going to lie onto your back, take some height under your head if you need to, and we're going to gather the elbows toward each other, lift the elbows up, so you see that movement, lifting up. Bend the elbows as much as you can while keeping the elbows lifted, and then gently let the head turn from side to side. So there's a spreading across the upper back while you're releasing the neck. So just nice and easy. Keep that lift of the elbows and the forearms. And come back from there. Place the pole down. And finally, you're going to take your mat, and again you can use a towel or something similar if you don't have a mat, but I'm just rolling up this mat fairly tightly like this, so you have a tight roll, and you're going to lie down on the rolled mat like this, so that the breastbone, which is about there, is in line with the bottom of the roll. If you find when you're on the roll your chin is doing this, then take some extra height under your head, like an extra pillow or cushion. Lengthen your sit bones away from your lower back. Lengthen the back of the neck slightly. And then in this position, shrug your shoulders up toward your ears. Pull them down away from the ears. And roll the shoulders back. Slightly lift the tailbone. Inhale. Roll the shoulders forward. Leave the pelvis on the floor. Arms straight up into the air. Shrug your shoulders up toward your ears. Pull them down away from the ears. Squeeze the shoulder blades back toward the roll and lift the tailbone slightly. Inhale. Reach up into the fingers. Creases of the elbows facing each other. And just stay like that for a moment. Keep the shoulders away from the ears as you're doing this. Take both arms out to the side. Rest the forearms down on the floor. Lift the tailbone. Inhale into the belly. Come back from there. Place the tips of the thumbs together. Again, creases of the elbows facing each other, and slowly take the arms back, keeping the armpits facing forward. So that's this action, armpits forward. Keep reaching back into the fingertips, armpits forward, reaching back into the fingertips, armpits forward. Then slightly lift the tailbone, relax the abdomen, relax the belly, and take a breath into the belly. Lower the pelvis, come back, palms of the hands together, gather the elbows toward each other and lift up into the elbows. This time let your chin lift slightly. Slightly lift the tailbone. Inhale. Lower the pelvis, bring the arms back. Roll off your roll and lie flat for a moment just to feel the effect of having worked with the shoulders this way. And finally, the last exercise for the shoulders is we're going to mobilize the upper back. And we're going to do this by, first of all, rolling both shoulders forward, so you turn both arms in. Will look like this. And as you're doing that, stand up tall so that your pelvis is not moving. Then we're going to do the opposite, bring the arms back. You could interlock the fingers, and as you do that, take the tailbone forward. Again, roll both arms forward, stand up tall, move the sit bones back slightly, roll both shoulders back, tailbone forward. One more time, turn both arms in, sit bones back, move arms back, tailbone forward, and release. And that is shoulder mobilization, releasing the upper back and neck. Thank you and namaste.